Hi, everyone. Good afternoon. This is County Executive Pat Ryan. Thanks for taking a few minutes on this rainy Thursday to check in on our COVID update and our vaccine update. Overall, continuing to make good progress with our vaccination effort, and I think we're really reaching an inflection point there in a good way. We're still concerned with the COVID infection rates, and I'll talk about that in a moment. But overall, we continue to make progress against this now over a year into the pandemic, and the light at the end of the tunnel is getting closer and closer every single day. So thank you for hanging in through this and all that each of you have done. And I will dive into the update without further ado. So looking at the data, our cumulative positive tests since the beginning of the pandemic are approaching just shy of 12,000 total cases. And we've now crossed the threshold of over 300,000 tests administered in the county, with 10,127 recovered, and unfortunately, 2 more fatalities in just the last 48 hours from those that were hospitalized and fighting COVID. So we continue to see the tragic toll of the virus. And that is all the more reason to really re-up our efforts individually to slow the spread and stop the spread, and of course to speed up our vaccination efforts, which we are doing. Looking at the hospitalizations, we're about the same as we were 48 hours ago. We currently have 6 residents hospitalized in Ulster County, 1 in the ICU. Those numbers have stayed around that level now for a few weeks, thankfully. The active case rate, once again, same thing I said 2 days ago. This is still far too high. We currently have 1,592 active COVID-19 cases in the county. That is still higher than at the peak of our first wave, going back to March and April of 2020. So I know it feels very, very different in many ways right now, but when you just look at the numbers and the data, we have a higher degree of COVID now in mid-March 2021 than we did a year ago in mid-March and April of 2020. And that should be a sobering reminder of the work we still have to do. Looking at the new positive test rate, once again, higher than we would like. In the last 48 hours since our last update, we are at a 5.69% new infection rate. In that 48-hour period, we have tested 2,778 and had 158 new positives. To be now well over 5%, closer to 6% new positive, that is unacceptable. We have to get this rate down, and that means really re-upping our vigilance on the precautions and the safety measures, as frustrating and limiting as that can be. The last thing we want is to see numbers start to creep back up just at the time when we're finally beginning to approach a critical mass of residents vaccinated. We are so close to being at that point, and it would be a huge shame and as we know, impact many, many lives if we can't just hold this a little bit longer and get through and down fully the backside of the second wave. Projections looking out in the long term, you can see here we're still on a fairly steep curve in terms of the even the best case of cumulative count. So that is really a reflection of that new positive rate. We have to flatten that out. Looking at our long-term hospital capacity, this continues to be good, more than adequate capacity for near, medium, and long term. And you know, once again, I know we say it every time, but the individual decisions that each of us continue to make as we're going about our daily lives in terms of work and interactions with family and loved ones, even with the vaccination rates coming up, it's still absolutely essential to follow those precautions, to wear masks, to maintain social distancing, to wash hands and use hand sanitizer, to continue to avoid the social gatherings that really kicked off this second wave, going back to actually Halloween and Thanksgiving and the winter holidays. We know that those gatherings were really a main driver of that, and so please continue to be cautious with those. Once again, soon we will not be in that point, but we're still in it right now. Talking about vaccines, not a lot of new updates today, but a few. I'm going to just quickly rehash some of what I shared on Tuesday. Our total allocation for the week in Ulster County, 3,770 total vaccine doses for this week in the county. That has been about what we've gotten the last few weeks, and we anticipate that will continue to go up as the federal government improves the supply situation. One of the big positive updates, and I was out there yesterday touring our new county-led pod site, point of dispensing site. We have relocated from the Kingston High School field house, where we've been for several months, and relocated to the Hudson Valley Mall at the former Best Buy location. Was there yesterday and did a walkthrough with our team. I want to really thank our collective team, Ulster County, our health department, our public works team, our information services IS team, a lot of other folks that worked very hard to convert that from a former Best Buy location to an empty building, and now a really well-oiled machine running today. And today we'll vaccinate close to 1,800 residents at that site. I also want to thank the whole group, the owners and managers of the Hudson Valley Mall, for really working with us to make that idea work. That's something we had wanted to do from the beginning, and we're really appreciative that we're able to use that site now. The big lift in capacity that brings us is, at the high school site, we could only vaccinate about 1,500 folks a day at the most. Now, because of the expanded space and resources at the mall, we can do upwards of 2,500 and possibly even up to 3,000 per day in terms of a throughput at that site. So as supply continues to pick up, we will be ready with our part of this, which is the distribution. And other great benefits of this site: the parking situation is much, much better than it was at the high school. It's obviously a huge parking lot with immediate access for all, including those with disabilities. And we have 300 spaces reserved there and more overflow if we need it. In addition, our UCAT bus service already had routes out there, but we've increased those routes. And for those that do need additional help with transit, any Ulster County resident can get door-to-door transit access from UCAT. We just need 24 hours notice of your appointment, and we can book that out with you. So if you need help with that, you can call our Recovery Service Center for that and many other things. But the number for the RSC is there on the screen, 443-8888, and they can help with transportation and any other questions that you might have. Here's the full list of all the other vaccination sites. So I know this continues to be changing every week, but we have our county-run pod site at the mall, and then there are several other partners that are allocated vaccine directly from New York State who are running their own either one-day or multi-day clinics, including all those listed. In particular, I want to thank again Reverend Childs. I want to thank Neil and his team at Village Apothecary. All of our local pharmacies now getting more doses finally, as well as our hospital partners at Health Alliance and Ellenville Regional. The whole team really ramping up our capacity, and that will continue to build. The other really exciting development, which we've all been hoping and pushing for a while and is now finally going to come to fruition, our New York State-run vaccination site, which will serve Ulster County but also serve any New York State resident. That opens up tomorrow, Friday, at the Ulster County Fairgrounds. There are currently appointments available on the New York State website as well. So to make appointments on that site, you can either call the number on the screen or you can go to the Am I Eligible page, which is the New York State page, to sign up for the New York State site. So if you are a resident, Ulster County or otherwise, looking for a vaccination, there are really two main places to go, and we are working to make that one, but for now it is two. The first is that New York State Am I Eligible site. That will allow you to see any appointments at any of the New York State sites, including the one here, our one here at the Ulster County Fairgrounds. And as of at least 15 minutes ago, when I checked, there were appointments available on that Am I Eligible website. So please do check that out for yourself and your loved ones. The other thing that you can do for our county-run site is you go to VACCINATEUlster.com. That's VACCINATEUlster.com. That is our pre-registration list where you get signed up, and as you're eligible, you'll receive emails with the links to sign up. And many of you should have received, thousands of you should have received that an email, for example, earlier today, actually, with links to sign up there. So the good news is a lot more supply and an improved distribution capacity put us in a great place. If you look by the numbers of our vaccination progress, we are now over a major milestone of 25% of our total population of the county have received at least one vaccine dose. So you can see 45,048 people as of this morning had received at least their first dose, and of course are guaranteed that second dose. So that's over 25%. If you actually do the math and remove those under the age of 16 who are currently not eligible for the vaccine, that actually makes us in the county over 30% of all who are over the age of 16. So doing even better in that regard. And I want to thank everybody that's been a part of that. I want to thank the state for working with us to very quickly stand up that New York State-run site, and that will serve, again, the residents of our county, but also of the region, and anybody's welcome to come. Of course, we're all have to work together to take care of each other and get as many people vaccinated as we possibly can. I talked about the Vaccinate Ulster page. Please, again, as a reminder, if you want to be made aware of any of the appointments for our Ulster County sites and just general information about all vaccines, we're also sharing links to the state site and so on. Please go on that page, VACCINATEUlster.com, and sign up. If you are not able to access the internet or to have a loved one do that for you, you can call our Recovery Service Center. That number, once again, is 845-443-8888. And as I said, we're regularly sending emails to those who've signed up and also making calls to those who are not able to access email. The last thing that I wanted to do today is twofold. I want to talk about our volunteers and our staff that are working at our vaccination sites and thank them. And I also want to put out a call for more volunteers and talk a little bit more about that. So much of the work happening at our county-led site and our ability to scale that up has been driven, of course, by our county team and our county staff, but also by really a growing group of several hundred volunteers, many of whom have worked dozens of days already in just providing this literal life-saving service to our residents. And so I actually wanted to share two emails that I got, and we get dozens of these a day. I picked two that I thought were relatively short, but also spoke perfectly to the work that our team's doing. You know, as more and more people are getting vaccinated now, finally, you will get to experience this as well, to go through our vaccination site, our county-led site, which I'm really proud of the work that we're all doing. And everybody going through there has complimented our process, and that's a credit to our whole team. And I wanted to just quickly read one email we got Sunday evening. The subject line was gratitude, which is always a nice way to start an email. Just wanted to take a moment and express my gratitude and appreciation. A monumental undertaking, coordinating, planning, and executing. I received my first Pfizer shot Sunday in Kingston and wanted to acknowledge how helpful and pleasant everyone was as they moved all vaccine recipients through the process. It was very reassuring to have medical and support staff guide us through the process. Thank you and your staff for all the sleepless nights and hard work that brought all of us to the site today to get vaccinated. So I won't shout out the nice person who sent that email, but thank you. And I've shared that with our team. And those words of gratitude mean a lot to those folks that are working 8, 10, 12-hour days, volunteering especially, to vaccinate now thousands of people a day. So thank you for that email. And I wanted to read one more that I just got actually yesterday afternoon. Subject, thank you. I wish I could broadcast a message to every single person involved. Well, here, well, at least we can read it to some folks. And there aren't even words to express my gratitude. Thank you and every single person involved in setting up the COVID vaccine program at the Kingston High School. I took my 80-year-old mother there and she got her first shot. I've been terrified for a year that I was going to bring the virus home to her. I had tears in my eyes almost the whole time I was there. I thanked as many of the volunteers as I could. It seemed like the room was completely full of love. We are from the hamlet of Walk Hill. Thank you all so much. So again, those are just two of lots of positive emails that we're getting as people are experiencing the not just receiving the vaccine, but as that last writer said, the support and the love of our community and volunteers that are stepping up. And so as we continue to do this work with vaccination, we need more help and more volunteers. So I'm going to put out a call again, and please spread the word as far and wide as you can. We still have, many more weeks, if not months, of work to do to get the other 75% of our residents vaccinated, and we need your help in whatever way you can. There are options for those, of course, with medical experience, but also those that have no medical experience, and there are a bunch of other roles all outlined on our webpage where you can greet people, you can escort them, you can just sort of be there for them and help them through the process, and all that's required is your willingness to help and do that work. We do recognize that doing that work and volunteering is a great service, but that it also comes at the expense of your valuable time. So we are now, for the first time, going to provide a stipend for both medical volunteers and non-medical volunteers. That's something we decided to step up to do, to really, beyond thanking our volunteers, to also make sure that they're compensated in some way for their time. And I know I have seen some Facebook comments saying that we should be compensating those folks. So we hear you on that one, and we are going to do that. And so if you are interested, please go to the link on our COVID-19 page there. If you go under vaccines and look for the volunteer drop down, you can navigate there as well, or just search it out. But if you want to volunteer, please reach out, and we'll get you taken care of from there. The other benefit, of course, to volunteering is if you haven't already received the vaccine, of course, you'd receive the vaccine as well for obvious reasons. So once again, thank you to our hundreds of volunteers that have been doing this work now for several months. And thank you in advance, hopefully, to many of you that are going to sign up, even if just for one shift of a few hours. I think it's honestly a personally rewarding experience and moving to see people so relieved and so thankful to receive the vaccine. So please take advantage of that if you can in any way, including there are some weekend slots too, in case for those I know that are busy and working. On that note, thank you to all of our frontline workers. A special thank you once again to our volunteers at our vaccination site, to our pharmacy workers across the county that are doing vaccinations, and to all of our healthcare workers continuing to take care of those that are sick in our hospitals and medical practices, and to everyone else doing this work and that has been doing it for over a year. We appreciate you. All the 180,000 residents of the county appreciate you. And we'll continue to do that and show that. We will do our next update on next Tuesday at 3 p.m. In the meantime, if you have any needs, once again, we'll put up the Recovery Service Center contact info. Please share that with those that do need help. Thank you for tuning in. Stay safe and healthy, and stay resilient and stick together, and we will see you in a few days.